All right, everybody, welcome to episode 5 of Honestly Bilal. I'm Bilal Ahmed. I'm a rising fourth year medical student at the University of Toledo. Today, I'm really excited to have a guest with me who I've gotten to know pretty well over the past couple of months, Dr. Tim Steinemann. He's a cornea specialist affiliated with the Case Western Reserve, and he's employed at Metro Health and in Cleveland. So, Dr. Steinemann, it is so great to be with you. Thank you for joining me, and looking forward to hearing from you.
Thank you.
So did you want to share your background and where you trained? I know that, you went to medical school, where I go to school. You were actually an alum from here.
That's right, Bilal. 1985, so that's a long time ago. It's 35 years. At that time, it was called the Medical College of Ohio at Toledo, now the University of Toledo. But alumnus there, and residency at the University of Kentucky in ophthalmology, and further fellowship training at in cornea and external disease and refractive surgery at LSU in New Orleans. My first real job, so to speak, was at the University of Arkansas, the Jones Eye Institute in Little Rock, Arkansas. And then for almost 21 years, I've been at Metro Health Medical Center, the Division of Ophthalmology. The faculty at Metro Health Medical Center are all also appointed faculty at Case Western Reserve University. And so I see my patients at Metro Health, but I'm not employed by Case. And we spend a good portion of a time besides teaching, or besides seeing patients at Metro Health, we spend time working closely with residents. And those residents are residents that rotate and spend nearly half their time at Metro Health, and those residents are based at the Cole Eye Institute Clinic Foundation across town.
Right. So you and I are both Ohio people from where we are right now. At least I'm from Kentucky, but I'm living in Toledo, and you're in Cleveland, so we're sharing the same state these days.
That's right. And so most of my time is spent at Metro Health in Cleveland. 80% of my time is appointed there. And as I said, when I'm there, I spend probably half the time working closely with the residents, teaching, as well as taking care of patients in the process. And when I'm not there, part-time, I work in private practice at an office on the east side of Cleveland called University Ophthalmology Associates. So quite honestly, I would say I have the greatest job in the world. I'm able to do literally everything.
Yeah.
Teaching, research, advocacy, serving, and at the same time, private office. It's absolutely the best of all worlds, because I'm able on a weekly basis, literally on a daily basis, to kind of taste of all the different methods and locations and patterns of ophthalmic care.
Right. And I think it's really important to highlight is that in ophthalmology, there seems to be, at least from my understanding, this hybrid of flavors. You can do private practice, you can do academics, and you can also do both. And I think that's something that you're obviously doing. You're kind of practicing this hybrid model in a way, which is very unique. And it obviously gives you an opportunity to put your hands in a lot of different buckets, which is very unique.
Bilal, I absolutely agree with you. And I would say, if I could just refer to a few notes that I made here,
Sure.
That I wanted to basically say, I mean, ophthalmology is no different than any other medical specialty. You can choose your way through life, but a lot of times it's not clear to you as a student. Certainly wasn't clear to me as a student what I really wanted to do, or what really, I had an idea, not only ophthalmology, but kind of how you want to do it. And I think ophthalmology is obviously the greatest field in all of medicine, but it also allows you the flexibility to kind of design your life kind of the way that maybe you don't even realize it, what you may want right now.
Sure.
But there's a certain flexibility in ophthalmology in that so-called practice type, those activities that are outside of direct medical practice or outside of direct patient care. So, research, academia, teaching, basically community hospital affiliation, and in my case, policy work or advocacy work.
Yeah.
So as I said, it's flexible, and it allows me the ability to kind of do a variety of things on a daily basis, which ultimately I want to emphasize. Why do I do it? Because it's fun.
Right, right. And I've always heard, I mean, I think we all know as we learned from great people like, Steve Jobs, for example, if you love what you do, then you'll do great work, So I think,
It's easy to do. It's
right,
easy to do if you love it. And if you don't love it, it's the hardest job in the world.
sure,
And that's
absolutely.
probably one little pearl or one little tidbit that I can offer your viewers, that you got to love it, and find something that you love, and find a way that you can love it in a variety of settings. And that's what it's really all about.
Yeah, yeah, absolutely. And I think that's the sort of inspiration we look for in mentors, because I think it's very natural to want to identify with somebody who's been in a field that you really you aspire to be in. And I think it's very empowering to know that there's people who not only are accomplished and have done a lot in that field, but they still maintain that joy and satisfaction and passion for it throughout years and years of practice. And I think that's one thing I've found in ophthalmology, is that people such as yourself who've been practicing it for a very long time are very happy. And I think it's one of the happiest fields of medicine. And I think that draws a lot of interest in it for people who aren't lucky to be exposed to it. So I think it's really,
I think you're right.
yeah.
I will tell you, again, just from my own remembrance of it, I was struck immediately when I took a 2-week rotation, actually in Toledo,
Oh, okay.
of how happy people were.
Right.
And I will tell you that if you look at practitioner surveys, something that you might see on Medscape that they do annually,
Right.
ophthalmology ranks, if not at the top, it's almost always in the top 5 of specialties that are, kind of like, would you do it over again? Are you happy? Job satisfaction, both when you're at work,
Right.
when you're not at work.
Right.
Ophthalmology is probably one of the highest specialties in terms of satisfaction rating, and with good reason. I mean, it's an amazing specialty.
Yeah, absolutely. And a lot of my viewers, a lot of people, the audience who listens to this show and this channel and podcast are people who are trying to get into the field and learn more about it. And it's really unique to have you today, because you are my first guest who's been an accomplished academic and private practice both, and just generally known throughout the ophthalmology community at many different levels. And one thing I want to touch on is that, you mentioned that you're an advocate and you're also a mentor to residents. You're being awarded this fall by the American Academy of Ophthalmology for being the Outstanding Advocate of the Year. So congratulations on that. And
Thank you.
also you were just awarded by the residents at Metro Health for being Instructor of the Year. So kind of tell us, as early as medical students who are trying to seek that transition into being a trainee or a resident in the future, hopefully in ophthalmology, talk about how mentorship and advocacy have been cornerstones to your professional journey and career, and why those are important to you.
Well, I think mentorship starts with good teaching, and I think been very, very fortunate to have some excellent teachers along the way, going truly all the way back to college. People that may not have been, first in my mind, but obviously they're always in the back of your mind. Those voices are tremendous, and you can have such a tremendous influence as a mentor, as a teacher, that
Right.
To me, that's, again, why do I do it? Because it's fun.
Yeah.
And it's impactful. And we do it on a daily basis, one-on-one in the clinic when I'm teaching the Cole Eye Institute residents. I love what I do. And obviously they reciprocate. They show that maybe what I'm doing is beneficial to them. And I hope that I can give it back, to students, to residents. And if you think about advocacy, we're really teaching our patients on a policy level. So if we give it back, it's obviously that altruism is very satisfying.
Yeah.
And it's why we do it. But I will tell you that having tremendous teachers going all the way back to college and having some kind of early experiences that kind of guided me, I think that's really how I got started in it. I had great teachers in basic sciences, in college, I did an exchange semester in Washington. I didn't know it at the time that I would ever do anything in policy, but I spent basically 6 months at American University in Washington, D.C. Little did I know that that would kind of come back later, and that kind of set the tone for policy. It was an early interest, but I've never been what I would consider a policy wonk or particularly political.
Sure.
But on the other hand, it's all about teaching and about being able to express an opinion. And then I would just say to all of your viewers, even as students, you have an opinion and you have basically a well-informed opinion. So don't sell yourself short. Even though you may be early on in your training, you have a lot to offer, you know?
Sure. Yeah, I think that's important because, for example, how you and I met was mostly through social media, through Twitter. I heard about your name through my school when they released an article that you wrote in the American Academy of Ophthalmology about contact lenses and exposure to COVID, and it piqued my interest because I saw a name who I'd never heard of, and then I realized that you were a graduate from my medical school, and then I chose to try to find you on Twitter, found you on Twitter, reached out to you, and just like that, things happen, and I was able to have a platform on Twitter for medical students in a way of sort of have a small voice, and you encouraged me, I think, to kind of continue that voice and to really embrace it for positive change. And I would just want to touch on, like you mentioned about policy and advocacy, how do people like myself who are fairly early in any stage of this, at what point do you feel that we should have the confidence of knowing that we can have a stronger voice in advocacy, and how do we have that voice? What is your preferred
now?
Yeah. Yeah.
I mean, you can have a voice now. I mean, I truly mean that. And I speak to your viewers and to people that, again, may be in school, maybe early on in training, but again, you've got a well informed opinion about a lot of things because of your education. And just understand that advocacy is, first and foremost, it's teaching, but it's an expression of or a hope of shaping opinion. And understand that opinion is backed by facts and by reasoning, and you've got a lot of that in your favor. And so, again, don't sell yourself short. There are many people, obviously, that do this for a living in Washington and state capitals all over the United States. Don't sell yourself short. As doctors, we are teachers, but we're always advocates too. We're advocates for our patients and for a larger level for public health.
And have you found that advocacy has come natural to you, or how was that learning curve when you found yourself presenting on these national sort of forums and speaking on behalf of ophthalmologists throughout the country? How do you handle that sort of, I guess I like that pressure, or that you are the single voice for a platform? So how does that naturally come to you?
I don't think it comes naturally. It certainly didn't come naturally to me personally. I will tell you that I like to be well informed. I mean, even thinking back to when I was a kid in grade school, I like to read the newspaper. I like to watch the news.
Sure. And
that's part of it. Part of it is learning how to voice those opinions in an intelligible and impactful way. And I think that can be learned just like anything else.
Yeah.
I will tell you that as a spokesman for the American Academy of Ophthalmology and as an advocate for the American Academy of Ophthalmology, I've worked closely with some very, very talented people, both in the main office in San Francisco and in the Washington office, the policy office in Washington, D.C., and they've helped me immeasurably. And just learning kind of the ropes. A lot of it is practice, but a lot of it is a credit just to some, again, excellent teaching. I'm always learning. I'm always willing to learn new stuff. And that's really what it's all about, is kind of staying not only current, but I hate to say it, stepping out of your comfort zone. It is not comfortable for me. Public speaking is not naturally comfortable for me. I will tell you that I do not like getting up on a podium.
Really?
Now, I will tell you that I don't mind giving interviews, but put me in front of 500 people at the Academy giving a talk on something, I'm shaking in my boots. I don't like it. I can do it, but
Right.
I don't necessarily embrace it.
Sure. Sure. And that vulnerability is something I think makes it a very human aspect to all of us. I mean, at any stage of your trend, your trajectory in your career, that vulnerability to be like, I'm not comfortable, is something that we have to embrace sometimes. I guess at least I've learned, at least in being a college student, and medical student, is that it's okay to have that vulnerability. And
Exactly. Step
yeah,
out of your comfort zone. And there's
sure.
another pearl for your viewers. Don't be afraid to step out of your comfort zone.
Right.
Um, I think most of us probably, I think it's safe to say we don't do that enough.
Sure.
And I will tell you that you'll never grow unless you step out of your comfort zone.
Absolutely. And you talked about lifelong learning, and we you and I have talked about that in the past too. And how has that process of being a lifelong learner, because I think you and I can both agree that that's something that you really champion. And how has that been part of your efforts in at least the last few months with social media during COVID-19, and how that learning curve by using Twitter and sharing the voices of others, how has that impacted you as learning this new technology and doing Zoom meetings with young med students like myself? How has that been for you?
Learning all the time. And I've been on Twitter for a few years now. How did I get on Twitter? I got on it because, again, some young associates in the San Francisco office of the American Academy of Ophthalmology encouraged me to try it. Why? Because we were doing an advocacy campaign and they wanted to have an advocacy topic presented with what they call a Twitter party. I had no idea what a Twitter party was.
Uh-huh.
I'm still not the keenest on, I'm not the techiest or the keenest on media and all that sort of thing. But
Right.
again, I'm willing to try stuff.
Yeah.
And it works, you know?
Yeah, and it seems like something that you were genuinely enjoying now. I mean, you're active on Twitter to the point where you actually introduced me to a good friend of mine now, Ankur Parikh, who's at medical school at Northeast Ohio University and NeoMed, called NeoMed as well. And he's a rising fourth year as well. We're both going to be applying for ophthalmology, and I've never met Ankur, but you introduced us via Twitter. And you connected us, and now I consider him a good friend. We collaborate on projects together, research initiatives, and so it's interesting to see how quickly these relationships can really foster and be built on this media. And for you to be somebody who's willing to have that learning curve and to still connect other people, I think it says a lot. And I can tell you that people like myself, we appreciate it, and we want to make it fruitful and impactful as well. So going from there, then you actually really have a passion for teaching, and I know that you are keeping an ear on the situation with how COVID-19 has affected the application process this year in ophthalmology for medical students. So I wanted to talk to you about what your biggest advice and your tips are for applicants such as myself in this upcoming cycle this fall, and what you really see as challenges or opportunities for us.
Well, full disclosure, I'm not a program director, and I work closely with the residents, but I am not somebody that is choosing directly resident applicants, but I work closely with the residents from the Cole Eye Institute. And I've worked with the residents from University Hospital, which is the flagship hospital of Case Western Reserve, for years.
Right.
So I've worked with a lot of residents for a lot of years. And this year, the cycle is different.
Mm-hmm.
Obviously, it's kind of, the COVID has kind of thrown a wrench into everything. And the pandemic obviously has restricted people's mobility.
Mm-hmm.
I mean, I will tell you that, yeah, I get it. I identify with it. 36 years ago, Bilal, that the position that you're in, which
Mm-hmm.
is a med school that really doesn't have a program, that was me.
Yeah.
So
yeah.
I'm very sensitive to that.
Right.
But at the same time, I think that it's doable.
Mm-hmm.
There are things that obviously you want to find a mentor, you want to find a project,
Right.
whatever that project may be. Maybe you're really into research and really great at statistics. I'm not the keenest in terms of basic science research or even statistical analysis or statistical design. I need a lot of help in that regard.
Mm-hmm.
Not afraid to say that.
Yeah.
But again, find those people, find those helpers,
Mm-hmm.
find a project, find something, even advocacy, find something to kind of sink your teeth into. That'll get you started.
Yeah.
And the benefit is finding that mentor that can help you ask the right questions for a project, but also may help you ask the right questions and guide you as you go through this extraordinary process occurring this year because of the pandemic.
Right. And I think that's really important. And I think what we've learned, a lot of the medical students who are applying ophthalmology this fall from these, this plethora of webinars that we've had in the last few weeks is that mentorship. And we talked about how you want to build a team of mentors, and different mentors can teach you different things about, the field and your place in it and what you can do to be impactful and to learn from. And like you said, for me, Dr. Jay Sridhar at Bascom Palmer reached out to me and offered me to, help with some research stuff or write some stuff up. And that was really beneficial for me. And you reached out and tried to get me connected with other people as well. And I've been lucky enough to get to know some people in the field through this avenue that you're talking about. And I think it's really important that you said that, without a home department or a program, it's not hopeless. I think that we can't just be negative about it and think that there's no chance. We just have to try to be creative and innovative and put ourselves out there. So going from there, then I wanted to also get your perspective on, I know you mentioned that you're not a program director in any way, but I'm sure program directors who have shared with you, or you may have overheard how they're dealing with the situation this year. So obviously from the medical student point of view, it's a little stressful, but what do you see as challenges for program directors that you think medical students such as myself should keep in mind, because it's not easy on them as well with the volume of applications they're expecting or just the challenges of virtual interviewing?
Understand, you get it, that it's a two-way street, and all of the anxieties that you have as students, I'm speaking to your viewers, all of the anxieties, I can tell you the program directors, even though I'm not one,
right,
I know enough about residencies and how they run, they are experiencing them too.
Yeah.
And again, you want to shed your program in the best light, just as you as students want to advocate and shed the best light on your accomplishments as you apply to residency. And it's doable. And it's going to work out fine. I want you to know that.
Right.
But it's going to take a little bit of ingenuity this year, because things are most likely going to be done virtually and electronically. And sometimes it's a little bit trickier, but you guys get it. You're raised on this stuff. And I will tell you that has got to be a comfort for you guys. Whereas for me, you see all my gray hair. I mean, I wasn't raised on this stuff.
Right.
It doesn't come naturally, but for you guys it will.
Right.
Because this is what you know. Right.
And you and I have talked about how social media is it's a game changer, and I really invest in and believe in it as something that is, and as a lot of us do, that is something that to give us a voice again, or to give us
again, I couldn't agree more, Bilal. I think that the social media gets people together. It kind of speeds up the process that would have occurred naturally anyway. Right. But it will speed it up, and it brings people together.
Right.
We talked about this before. Twitter is a disruptor of medical science. Why? Because it gets to the heart of the matter. Yeah. It cuts through kind of all the BS and all of the verbiage of kind of this kind of very, very stodgy scientific writing, and cuts to the chase. Yeah. It's not only a disruptor of science or medicine, it's a generational disruptor. Right. See, you and I have gotten to know each other. Yeah. And again, I hope we get to meet someday. I hope so. But we know each other virtually, and likewise, you know Ankur virtually. Right. And again, all of this is going to happen on a level with programs too. For all your viewers who are applying to ophthalmology residency programs, this is going to happen too. And Twitter, again, is the common element.
Sure. And I think, excuse me, I really think that you emphasizing that means a lot, because obviously, like you discussed, that this is not a preferred, or it wasn't an easy transition for you to jump on this platform and use it in a way that you felt was natural to you, but you've embraced it. And I think, like you said, that this is a new frontier in a way. I feel like it's almost like this year and this time in this era is kind of one of transformation. It's almost like I talked to my friend the other day about it, how it seems like it's almost like the wild, wild west right now with social media, because you can really just have an interaction with somebody who in the academic hierarchy may be a little bit higher than you, but you know, if they're willing to respond, it just means a lot. And it means that, you know, it seems like they value your input on stuff. And, you know, you never want to be overbearing or, you know, take too much time from somebody who's busy, but it's nice to have a response from someone who maybe you wouldn't meet across the country in California or in Florida or in New York or wherever. So, you know, it means a lot for you, I think, to endorse that for us. And I think that we've talked about this, but you know, I think that, and you and I both agree that more medical students should jump on the Twitter train and be confident with it, that it's an important aspect of their professional life as well.
I couldn't agree with you more. I'm going to sound like an ad for Twitter. And by the way, full disclosure, I'm not, I don't have any vested interest
Right.
in this medium.
Yeah.
I don't get paid or anything like
Me
that.
either.
But I will just say that it's fun, it's addictive, but it brings people together, and it cuts through, you know, cuts through a lot of the chaff.
Yeah.
And you can get to things quickly.
Sure.
I will tell you that professionally, this is something that we are seeing more and more of, even as we go to work.
Mm-hmm.
What the pandemic has taught all of us is that we don't need to physically have the patients in our office, in our lanes every day.
Right.
And that was something that obviously was a huge concern for a lot of our elderly patients coming to the hospital in the midst of a pandemic.
Right.
How do we get around it? Telemedicine, teleophthalmology.
Sure.
Again, this medium is, it's a game changer. It's huge.
It is. I agree 100%. And you know, we're seeing it now. You and I, you shared an article with me that we talked about earlier before we got on here about how social media has impacted ophthalmology. And I believe it's written by Dr. Edmund Sui at UCLA and a researcher and Dr. Rao from University of Michigan about how, you know, more academic departments and other practices are really starting to invest in Twitter, Facebook, Instagram platforms. And, you know, it's a way for research collaboration to occur. It's a way for us as applicants this upcoming cycle to really get an understanding of the programs themselves too, by seeing, you know, a day in the life of a chief resident or a day in the life of a program director or the culture of the program, which I think is really important for fit and for camaraderie and teamwork and how people get along at the institution. So like
I think that's a good point there, Bilal, and that might be the toughest part of this whole cycle this year, or however long this takes for the pandemic to resolve.
Right.
And that is doing things virtually. It's hard.
Yeah.
Again, you want to shed the best light on yourself. The programs want to shed their best light.
Yeah.
It's hard to learn enough in a very brief encounter, which is virtual.
Yeah, absolutely. And, you know, I think that's, we will be watching very closely everybody from the educational side of things this upcoming cycle and how it will evolve. Especially it'll be interesting in the spring and summer next year to see how those transitions occur when hopefully this all subsides. We don't know enough, but we're hoping, I think we're all hopeful that things become normal to a relative state again. Dr. Steinemann, I just wanted to finish up with we talked about a lot of stuff, a lot of academic stuff and advocacy and lifelong learning. But share with us who you are as a person, what do you like to do for fun, your hobbies, interests, what do you do in your spare time outside of ophthalmology even?
Well, as you can imagine, I stay pretty busy. And as I mentioned to you before, why do I even do stuff like this? Because it's fun. So I hate to say it, I got a one-track mind, but this is some of the fun stuff that I do, is discover kind of nuances of ophthalmology through different methods. Yeah. So, you know, you can teach an old dog new tricks, as you know, the old saying. And yeah, I got plenty of gray hair. I'm an old dog, but I will tell you that it's fun. Yeah. But you know, I've got a wonderful wife who understands this. Susan and I have been together since we were in college, and she's been with me every step of the way. And so when I'm not working, obviously I'm at home with her. I like to grill out. I like to cook. Okay. And we do some fun stuff. I'm not going to be doing anything today. That it's intermittently raining here, but yeah, I've got the big green egg grill in the backyard, and I like to marinate and, you know, grill out and do stuff like that. Right. Concoctions in that way. Yeah. What else do I like to do? Music is a tremendous release for me. I'm not a great musician. Sure. I play piano. Okay. I through no planning of my own, I realized in retrospect, I've lived and trained in places that were the foundation of roots music across the United States. So I've always been interested in classical music,
Okay.
country music,
Mm-hmm.
jazz, blues,
Mm-hmm.
pop music. I live in the home of the Rock and Roll Hall of Fame.
Yeah.
So I mean, bluegrass music. I mean, it's amazing. I never planned it this way, but I found out that this is absolutely a passion of mine, is
Yeah.
understanding all music came from somewhere, and
Right.
understanding the roots of that music. I've lived in a lot of those places.
Mm-hmm. Yeah, I mean, Kentucky bluegrass is obviously a big part of the culture there. In Arkansas, I'm sure there's a lot of different dynamics there that you had, and also Louisiana. I mean,
Delta blues in
yeah,
Arkansas,
I
and
mean,
in New Orleans, you got basically New Orleans blues, and it's the foundation of Jelly Roll Morton and jazz.
uh-huh. So there's a rich history in all these places. So it seems like it was destined for you to be a musician in some way or another as well, even as a hobby, even if you're not, in the professional scene or anything like that. Well, Dr. Steinman, it was a pleasure to be with you. I hope that we get a chance to meet in person someday, have dinner. Maybe I'll have something that you grill for me or something like that. I don't know how well I can grill for you, but you never know. So it's been a complete honor for me to talk with you. I think your perspectives are full of wisdom, and we really appreciate anything you're willing to share. Where can people find you on Twitter if they would like to follow you?
So it's Dr. Steinemann, MD,
Okay.
on Twitter, and email Steinemann, that's Steinemann at Metro Health, one word, metrohealth.org. Be happy to entertain any questions. Follow me on Twitter. All I will say is that, again, it's a great disruptive, wonderfully disruptive technology.
Yeah.
I've learned a lot. You can teach an old dog new tricks, and keep learning. That's what it's all about. Just one more thing I will say proudly, I am of the last generation of cataract surgeons who were trained manually, meaning that even phacoemulsification was not done when I was a resident.
Oh, wow.
But again, I adapted, I learned.
Right.
And this is something that I can tell to all you aspiring ophthalmologists out there. It's going to be the story of your life. Keep learning. It's the hardest. It's exciting, but it's the hardest thing that you'll ever do, which is to stay current.
Sure. Yes, sir. I would think we will all definitely remember that from this, whoever's listening out there. And we appreciate you being on here, and you're welcome to come back anytime. Love to meet you in person someday as well.
Thanks, Bilal.
All right. You take care. Thanks so much for
Thank
joining
you.
us. All right.